Lesson 8, maybe you think I've been provocative enough already, but I wanted to be even more provocative and argue that ideology can get in the way of progress, our rather kind of stuck view of the world. And my first example here is the polypill, something that probably most of you have heard of and that oddly I've been very associated with, because the papers that really put the concept of the polypill on the map were published in the BMJ when I was the editor, and I got very carried away and said, maybe this will be the most important thing that will be published in the BMJ in 50 years. And it's the idea that you can combine, in the original study it was 6 drugs into one pill, and that everybody would begin to take that pill the minute they were 55 without any kind of testing or anything. They just, on their birthday, they'd get a packet of pills and they would start taking them thereafter. And the pill contains 3 antihypertensives at half dose, because then you get 80% of the benefit but with only 20% of the side effects, a statin, an aspirin, and in the original one, folic acid, because Nick Wald and Malcolm Law, who developed the idea, believe rather passionately that folic acid can be beneficial. I mean, other people argue about that. Now, we don't have a randomized trial of giving the pill to everybody at 55 and seeing what happens over 5-10 years, but one of our centres, the one in Bangalore, is actually going to be conducting such a trial funded by the Wellcome Trust. But actually there's every reason to expect that this would work. It would be very surprising if it didn't. And Nick and Malcolm argue that if we were to move to this system, then 80% of heart attacks and strokes could be avoided. I mean, it might be 60%, but it's likely to be a very high number. And immediately this evokes all sorts of anxiety in lots of people. And I'm sure that some of you as public health people think, well, this is ridiculous. This is a substitute for encouraging healthier lifestyles and creating environments that are healthier. People won't bother to live healthier lifestyles, they'll simply take a pill. Well, I don't think that's necessarily the case. I don't see these things as being mutually exclusive. And one of the marvellous things about the polypill is that actually it can be manufactured, and it is now being manufactured. There are at least 3 versions available in India for less than $1 a month. So it's this is a very cheap pill that can have very profound effects. Drug companies, they're rather upset by it because all these drugs are off patent, which is why it can be made so cheaply, so it's potentially destroying lucrative markets. It upsets doctors because it's sort of saying the traditional model of diagnose and treat simply doesn't work, because many of the people who have heart attacks and strokes have not been identified as being at high risk or are not being treated. So I suppose I use it here as an example of, whereas the reaction of many people is immediately, this is a ludicrous idea, actually maybe we should think more seriously about it. Here's another thing that's sort of slightly upsetting, that sort of says that actually this curve by Kuznets, famous curve from 1955, says that actually as countries get richer, on the whole, inequality initially increases, certainly something you see in a lot of low and middle income countries, but then it eventually decreases. And here's a version of that curve for sulfur dioxide, for a pollutant, that actually as we get richer, pollution will go down, so that climate change to some extent will begin to sort itself out. I put these up because they sort of, they potentially make people feel uncomfortable and think, well, this sort of implies that if we just encourage economic growth, things will sort themselves out. And maybe that's the case, or maybe it's not. And then lastly here, something that's been very much argued about in Britain, the role of the private sector in healthcare and health systems. as you'll all be aware, the NHS is in some ways at one extreme of the relationship between public and private, insofar as it's one of the most care in Britain is publicly funded, it's publicly provided, so far as the NHS is, they're part of the public system. And then we've got, America, where there's much more private sector involvement, and that looks fairly disastrous from the point of view of people in Britain. And so organisations like Oxfam and such like are very much kind of pushing the model in the world that everybody should try to move towards a more publicly funded and probably publicly provided system. But of course the reality in South Asia and sub-Saharan Africa, as this slide shows, is that the vast majority of care is actually provided now by the private sector. Included in there, of course, are lots of local village practitioners and healers. And my argument would be that actually by saying, we have to kind of have the whole thing run by the government is a very kind of British NHS view of the world, and that it makes a lot more sense to recognise the importance of the private sector. I use these really just as examples of things that may feel uncomfortable to people in public health, but my fundamental lesson is let's not let ideology get in the way of thinking about how we can really make a difference to health.